The legislation introduced the Patient Safety Act, HB 106 and SB 240, that would set minimum staffing standards based on the unique needs of different units and how many patients they treat. Studies have shown that this saves lives, reduces errors, decreases complications, and improves patient satisfaction while also reducing nurse fatigue and burnout. Would you support guaranteed minimum nurse-to-patient ratios, and what would you do as governors to advance the decades-long campaign in Harrisburg?
Venus, I'll sign it under one condition. If you're sitting right next to me when that bill reaches my desk, okay?
All right.
Absolutely. There you go.
Anyone working in healthcare, we know that quality care delivery is a team effort that requires both direct caregivers and the support staff like environmental services and dietary workers. Unfortunately, many support staff make below a living wage, including at my facility at Chestnut Hill Hospital, where our subcontracted workers just fought and won a wage increase. What will you do as governor to drive higher wages for essential workers who have sacrificed so much to keep us safe during the pandemic?
We've got to make sure that we look, at the full continuum of care. The folks who are, cleaning up the rooms are just as important as the surgeons performing the surgery. Everybody fits in. One can't do their job without the other. You clean the room without the surgeon, that ain't going to help the patient much. If you've got a surgeon that doesn't have somebody clean up the room, getting the surgery prepared, they can't do the surgery. We have to have the attitude that everybody's kind of linked together like that. And when you have that attitude, then you got to focus on how do we lift up wages. Part of that is you got to get wages across the board up. It is insane that we still have a minimum wage of $7.25 an hour. That is not okay. And while I recognize you're probably not making the $7.25, that being so low impacts the wages everybody else gets. We got to get the minimum wage up. Y'all have been fighting for 15 for a long time. So have I. I'd like to get that done and make that a part of my first budget. You'll start to see wages come up. And then we just have to, as I interact as governor with these major healthcare institutions on various issues that I'll interact with them on, we can't let worker issues, worker rights be an afterthought. So when they come to me because they're interested they want to expand their hospital into a new area, or whatever the case may be, I'm speaking very generally here, it's going to be incumbent upon me, and I will do this. I've got a track record of doing this, of saying, yeah, I hear you on that, but what about all those workers? How are we going to make sure that they get helped as part of this process? So I think, a big part of that is just going to be the attitude of the next governor. I obviously have you in mind. The 9 Republicans I'm running against, they could care less about you. They're just focused on the profits of these big corporations and these big healthcare institutions. So that's the difference. That's the approach I'll take.